Hey everybody, and welcome to the deep dive. Today we're diving deep into cardiac catheterization.
Ooh, that's a good one.
It's something that might be on your mind right now.
Mm.
Maybe you're prepping for the procedure, or maybe you're just curious about what happens when doctors need a closer look at your heart.
Yeah, for sure.
We've got some really interesting sources here, and we're ready to unpack why not every cardiac catheterization ends with a stent.
Yeah, that's right. It's not as straightforward as some might think.
So, to kick things off for anyone who might not be familiar with the term, what exactly is cardiac catheterization?
Well, it all starts with a thin tube, a catheter.
Okay.
It's inserted into a blood vessel,
Mm-hmm.
typically in the arm or groin, and then this catheter is very carefully guided to the heart.
Okay, so it's like a tiny camera crew getting a live feed from inside the heart.
That's one way to think about it. What's interesting is that this live feed can be used for both diagnosis, so like identifying potential problems, and also for treatment, actually fixing those problems right then and there.
Oh, wow, that's fascinating. Yeah.
So our sources mentioned some important prep steps before you even get to the procedure.
Right.
Fasting is a big one.
Uh-huh.
No midnight snacks before you get your heart checked.
Definitely not no midnight snacks. And your doctor will also review your medications. Anything like blood thinners is important to consider.
Yeah.
And of course, allergies, any allergies to iodine contrast dye, or even latex.
Oh, yeah, I remember reading about that.
Yep.
Speaking of the contrast dye, our sources mentioned a health assessment, especially focusing on kidney function.
Mm-hmm.
Why is that so important?
That's because the contrast dye that we use to visualize the heart can sometimes affect the kidneys. So understanding your kidney health beforehand really helps the medical team minimize any of those potential risks.
It sounds like there's a lot happening behind the scenes to make sure everything goes smoothly.
Absolutely.
Now, what I find really fascinating is the sheer variety of things that they can DO during a cardiac catheterization.
It's really incredible.
It's like a medical Swiss Army knife for the heart.
That's a great way to put it. They can do angiography to see those blood vessels, angioplasty to open up blockages, stent placement.
Yeah,
Wait, hold on. There are even more tools in this heart toolbox besides stents.
absolutely. We've got things like thrombectomy to remove blood clots, which is vital during a heart attack.
Oh, wow.
And they can even assess and repair heart valves, remove plaque buildup, and conduct electrophysiology studies.
It's mind-blowing what they can accomplish with this one procedure.
It really is.
Okay, so let's say you've had the procedure. What's recovery like? Is it the same whether you were just getting a diagnosis or had a treatment done?
That's a great question.
Yeah.
So immediately after the procedure, there's a recovery period where your vitals are monitored, the insertion site is checked, and for a simple diagnostic procedure, you often go home the same day.
Oh, okay.
But if you've had a stent placed, you might need to stay overnight.
That makes sense. And after you go home, are there any special instructions?
Yeah. Post-procedure care is really important.
Yeah.
Your doctor will likely advise you to avoid strenuous activity for a while, keep the insertion site nice and clean, and of course be diligent about taking any prescribed medications.
All right, let's get to the heart of the matter literally.
Okay.
We know not every cardiac cath ends with a stent, but what percentage actually do?
Well, our sources point to some interesting statistics. About 30 to 50% of cases involving chest pain end up getting a stent.
Wow.
But it's fascinating when we look at stable chest pain specifically, the likelihood of needing a stent goes way up if non-invasive tests, things like an EKG or a stress test, show poor blood flow.
So the initial test can really influence the course of treatment. That's insightful, but let's flip the script for a moment.
Okay.
Why might a stent not be necessary, even after all of this?
There are a few scenarios. Sometimes the catheterizations might show that your arteries are healthy or just slightly narrowed. In those cases, a stent would be beneficial.
So no blockage, no stent. That's reassuring to know. What about cases where there does a blockage, but maybe not severe enough for a stent?
Well, in those cases, lifestyle changes and medication can often effectively manage the blockage. Think of it as a heart-healthy makeover diet, exercise medication, all working together to keep things flowing smoothly.
Sometimes the best solutions are the simplest ones.
Often, yeah.
Are there ever situations where a stent isn't even an option at all, even if there are blockages?
Absolutely. If the blockages are too severe or complex for stents, a coronary artery bypass grafting might be recommended, the more invasive procedure, but sometimes it's the best way to ensure long-term heart health.
That brings up another important point. Not every cardiac catheterization is about dealing with blocked arteries. What about things like valve issues or congenital heart defects?
Right, you're absolutely right. Those situations wouldn't involve stents at all.
Okay.
The focus would be on addressing the specific valve or structural problem in the heart.
So it's all about using the right tool for the job.
Exactly.
And sometimes that tool isn't a stent. Now I'm curious about when stents are the go-to solution. When do they really shine?
One of the most common scenarios is coronary artery disease, or CAD.
Okay.
This is when there are significant blockages, say 70% or more, narrowing in the arteries, supplying blood to the heart muscle.
And what about emergency situations like heart attacks? Are stents used then?
Absolutely. In cases of acute coronary syndrome, like a heart attack, stents are often the first line of defense to quickly restore blood flow and potentially save a life.
Wow, that speed is crucial in those moments. But stents aren't always about emergency intervention, right?
You're right. They can also be used to relieve chest pain, known as angina, by improving blood flow. And sometimes they're used proactively as a kind of preventative measure.
So if someone is at high risk for a heart attack, a stent might be recommended to reduce that risk.
Exactly. It's about taking steps to protect heart health in the long run. Now, you might be wondering, what kind of stents are we talking about here? It's not a one-size-fits-all situation.
That's a great point. Our sources mention different types of stents. Can you break those down for us?
Of course. We have the bare metal stents, or BMS, which are essentially metal scaffolds that prop open the artery.
Yeah.
And then we have drug-eluting stents, or DES, which are coated with medication to prevent re-narrowing.
So they're like time-release medication capsules built right into the stent?
Yeah.
That's pretty cool.
Yeah, it's a pretty neat concept.
But wait, our sources mentioned something even more futuristic, bioresorbable stents.
Oh, those are fascinating.
Yeah.
They're temporary stents designed to dissolve completely over time, leaving behind a healthy, naturally functioning artery.
Wow. They literally disappear after doing their job.
Wow.
That's an amazing advancement in technology.
It really highlights how far we've come in treating heart disease.
This is all so fascinating. But for now, we're going to take a pause. When we come back, we'll continue our deep dive into cardiac catheterization, exploring more of the intricacies of this life-saving procedure. Welcome back to the deep dive. We've been talking all about cardiac catheterization.
Yeah.
And it's clear there's a lot more to it than meets the eye.
It really is.
Yeah.
It's a complex procedure with so many different applications. And like we said before, stents are a common outcome.
Right.
But not always necessary.
Right. There's so many factors at play.
Absolutely.
That's what makes it so interesting. It's not just a one-size-fits-all approach to heart health.
Exactly. Each patient's situation is unique, and the decision to use a stent is made on a case-by-case basis.
So there's a lot of careful consideration and planning that goes into each procedure.
Oh, absolutely. The goal is always to improve blood flow to the heart and reduce the risk of serious complications.
And our sources really emphasize the importance of understanding all the different treatment options available,
Right.
not just focusing on stents.
Yeah, think of it this way.
Hmm.
Imagine you're building a house. You wouldn't just use one tool, right?
Right.
You need a hammer, a saw, a screwdriver, all sorts of tools, each with a specific purpose.
Okay, I see what you mean. It's about having a toolbox full of options and choosing the right ones for the job.
That's a great way to put it.
Yeah.
And sometimes the best tool might not even be a surgical procedure at all.
Right. We talked about how lifestyle changes and medication can be really effective in managing some heart conditions.
Yeah, things like diet, exercise, and stress management can have a huge impact on heart health.
You mentioned stress management. I think a lot of people underestimate how much stress can actually affect the body,
Oh, for sure.
especially the heart.
Absolutely. Chronic stress can lead to a whole cascade of negative effects, including high blood pressure, increased risk of heart disease.
So finding healthy ways to cope with stress,
Mm-hmm.
things like mindfulness meditation, spending time in nature,
Right.
those can be just as important as taking medication.
They really can.
Yeah.
It's about taking a holistic approach to heart health, addressing both the physical and the emotional aspect.
And of course, regular checkups with your doctor are essential.
Oh, absolutely.
Well-
Preventative care is key. Your doctor can monitor your blood pressure, your cholesterol levels, all those important indicators of heart health. And they can also help you assess your risk factors and recommend some personalized strategies for prevention.
So being informed and empowered is just as important as any specific treatment or procedure.
Couldn't have said it better myself.
Now, we've talked a lot about the different types of stents and when they're used, but I think there's another aspect of this topic that's really important to address: the technology behind stents.
Oh, that's a good point.
Hmm.
You're right. The field of cardiology is constantly evolving with new innovations emerging all the time.
It's amazing how technology is changing the way we diagnose and treat heart disease.
One of the most exciting areas of research right now is focused on developing even more advanced stents.
Like the bioresorbable stents we talked about earlier, the ones that dissolve over time.
Exactly. Those are a real game changer.
Yeah.
Imagine a stent that does its job, propping open the artery, and then simply disappears, leaving behind a healthy vessel.
It almost sounds like science fiction.
It really is remarkable. And researchers are also working on developing stents that release medication even more effectively, targeting very specific areas within the artery.
So it's like precision medicine for the heart.
That's a great way to put it. And then there's the whole field of nanotechnology, which is opening up even more possibilities.
Nanotechnology, that's dealing with things on a microscopic level, right?
Exactly. Imagine tiny nanoparticles that can deliver medication directly to the site of a blockage or even repair damaged tissue.
That's incredible. It sounds like the future of heart care is going to be even more personalized and even more targeted.
That's the direction we're headed in. And it's all driven by a desire to provide the best possible care for patients.
It's really inspiring to see how far we've come and to imagine the possibilities that lie ahead. We've covered so much ground today, from the basics of cardiac catheterization to the cutting-edge technologies that are shaping the future of heart health.
It's been quite a journey.
And we're not done yet. When we come back, we'll wrap up our deep dive into cardiac catheterization, leaving you with some key takeaways and maybe even some food for thought. Welcome back to the deep dive. It's amazing to see how much we've learned about cardiac catheterization.
It really is.
From the details of the procedure itself to the future of stent technology.
This field is constantly evolving.
And it's all driven by a singular goal to improve heart health and ultimately save lives.
Before we sign off, let's circle back and distill some key takeaways for our listeners.
Okay.
What are some of the things you really hope they'll remember from this deep dive?
I think first and foremost, I hope they come away with a better understanding of what cardiac catheterization actually entails. It's often perceived as this scary procedure, but it's actually minimally invasive with a pretty quick recovery time in most cases.
Yeah, I think that's a really good point. Knowledge can really help alleviate fear.
Absolutely. And I also want to emphasize that not every cardiac catheterization leads to a stent.
Right.
That decision to use a stent is complex.
Yeah.
Based on many factors specific to each patient.
It's not about jumping to a solution.
Right.
It's about careful evaluation.
Exactly.
And choosing the best course of action, whether that involves stents, medication, lifestyle changes, or even more advanced procedures like CABG. Exactly. And that brings me to another key takeaway, the importance of proactive heart health. We've talked about healthy habits like diet and exercise, but it goes beyond that. It's about understanding your risk factors, talking to your doctor, being an active participant in your own healthcare journey.
So being informed and empowered is just as important as any treatment or procedure.
Couldn't have said it better myself.
This has been such an insightful journey into the world of cardiac catheterization. I feel like I've learned so much.
Me too.
And I hope our listeners have too.
I hope so.
And to all our listeners out there, thank you so much for joining us on this deep dive. We hope it sparked your curiosity and empowered you to take charge of your own heart health. Remember, knowledge is power, and there's always more to learn. Until next time, stay curious and keep those hearts beating strong.